Like that, or like that. This one? This one. We'll keep it here, but they will take another small one. Oh, yeah. Take it out, but no one will notice. Would anyone care for a printed copy of the slides? There might be, but I'll probably be the one taking.
Margaret, can you hear me? Perfect. Frank, can you hear me? Ed, can you hear me? All right. Welcome, Jean. I have printed copies of the slides in my hand. Would you like one?
Please, sir. Thank you.
You're welcome. You got it, Ursula. You're welcome. Hi, Patty. If you'd like one, printed copies of the slides.
Good, thank you very much.
You're welcome. Does anybody else need one that hasn't gotten one? You'd like one, Dick?
Thank you, sir.
My pleasure. What's that?
The numbers are mixed up.
How are they mixed up?
Page 1, page 4, page 3, page 8.
Oh, I see what it is. It's confusing. Slide 1, slide 2, page 1,
Oh, okay.
slide 3, slide
Okay,
4,
Thank you.
page 2. That is super confusing though.
Yes.
Yes, Ms. Brock.
I have a question.
Yes.
Bistro, there's nothing officially open up, but anyway, I have used it, so I was kind of disappointed. The bistro
Oh,
to me was
okay.
like a bar, and when I went in there, there was all these sweets, Rice Krispie bars and all these things, and everything was 2 points. And there were sandwiches there in the refrigerator bar. Yeah, and so I don't know, I thought a bistro was a bar where you went and you brought your friend and you sit there and you talk, you know. But it's entirely different when I thought it was.
It's a starting point,
Yeah.
and then we'll probably be building on it as in the coming weeks and months.
And
So-
another thing, the coffee machine in the game room, it's always out of order.
Oh, really?
Always out of order. I don't know why they put a sign up there and all.
Yeah. They got 17.
Good afternoon, everybody. Welcome. We'll get started in just another minute or two. There are some printed copies of the slides on a chair in the back, but I've got a few here. Does anybody need a printed copy or want a printed copy that doesn't already have a printed copy?
We're still in business, right?
Oh, yeah. Is anybody else in need of a printed copy of the slides? All right,
Showing June numbers or July numbers?
June. All right. We've got 15 seconds. So if you want to take a quick snooze, before we get started?
Stand down, stand down.
All right, for those that are just coming in, Phil Stewart or David Hyde's got a stack of printed copies of the slides. I've got a few copies here if anyone needs one. I think we'll go ahead and get started. I would like to welcome everyone to our mid-year financial report. You all have copies of the slides, so my work here is done. Thank you all for coming. All right, questions. Okay, before we get started though, Marion Shane is going to kick us off with one quick announcement. Oh. I guess I should have given you a mic that was turned on, huh? There you go.
Community Currents, which is under the social committee, will be having a special program. Can you hear?
Yep.
We'll be having audiologist Christina Thrum come. And I want you to know, it's not just about hearing aids. Before I have a speaker, I give a group of questions that I want answered. And in this case, I thought you might like to know some of the questions, not all of them. What part does the brain play in hearing? Can brains be trained to help us hear better? Are there surgeries that will help hearing problems? What changes have taken place with hearing aids? What countries are doing research and what are they developing? What % of Audubon's budget goes toward research? We know hearing aids are very expensive, and so wondering if they're going to say it's all because of research. So hoping to see everybody or tune in, and it's going to be August 22nd at 3:30 and under Community Currents. All right, thank you.
Thank you, Ms. Shane, for that announcement. All right. I need 2 volunteers to, when we get to the question phase of the program, to be the microphone passers. The benefit is you get first dibs on the microphone. Anyone besides Linda, please, no. All right, Linda, I think that one's hot and I don't think that one's on yet, but. All right, well, welcome everybody. If anyone that just came in needs a copy of the and or wants a copy of the printed slides, I've got a few here.
Thank you.
You're welcome. There we go. You are welcome. Oh, sorry.
Thank you.
You're welcome. Anyone else? All right, I'll leave that extra one back here. Okay. So this is during the next 55 minutes or so, we will be it always works until you need it to work. Oh, man. All right, okay. So over the course of the next now 49 minutes, we will be reviewing some of the key financial performance indicators for the Terraces of Los Gatos operations from January to June of this year. We will take a look at some of the trends over the past few years, and then we will have lots of questions and hopefully just as many answers to those questions. If there are questions as we go about individual slides that we have up, please feel free to ask, and I will either answer it, or I will say, we'll get to that in another slide, or I'll say, I don't know, but hopefully there won't be a lot of those. So here we go. Overall, big picture, the operating margin for the Terraces of Los Gatos so far year to date is $140,452 ahead of the budgeted operating margin for the year. So we are pacing ahead slightly of where we anticipated being so far after the first 6 months of the year. 6 months, January through June. Yeah, 6 months. Okay, so this, and we'll explain more of this as we go, but I wanted to show just where we're at. This is a trend of January through June for the Terraces of Los Gatos. The first slide is the operating margin percentage. So what that is what percentage of all of the revenue from the Terraces of Los Gatos results in operating margin. The red dotted line is the budget target. The green line is the actuals. And again, this is operating margin percentage. Actual operating margin dollars we see on this side. Again, the red is the target and the green is the actuals. So first 2 months, we were basically right in line with budget. Second 2 months, we dipped a little below budget. And then the last 2 months, we went up above budget. So that is where we've been for the first 6 months. Now grab a shovel because we're going to dig into the details. It's a lot more funny when I wrote it. Okay, so operating margin. What is the operating margin? Operating margin is all of the operational revenue that comes in through all the different levels of living, through monthly fees, through insurance billing in the health center, and then all other ancillary revenue that comes into the community. We take that, which year to date is $17,755,000. And then we take out all of the employee costs, all of the other non-wage expenses, which gives us our operating margin. The budget for the first 6 months of the year is 1.9 million, and we are just above that at 2 million and change. So that's where we get that variance of $140,000. We'll get into more details, but just to highlight here, total employee cost, 9.7, 9.8 million, but we're budgeted for 8.8, 8.9 million. So nearly $900,000 over budget. We've spent over about $900,000 more on employee expenses year to date than budgeted. Fortunately, the revenue has been 1.1, 1.2 million over budget, which covers that added employee cost. Non-wage expenses $143,000 overspend compared to budget. Again, we'll get into more details here in a few slides. So what the next few slides will look at each individual level of living and then the revenue and associated expenses for each level of living. So first we look at residential living. We have three columns here. We have the actuals, we have the budget, and then we have the variance. So this is the first, first row here shows our total available apartments. We have 175 residential living apartments. Our average monthly occupancy so far this year is 166.9 occupied apartments, which is a 95.4% occupancy. The average monthly revenue per occupied apartment is $6,667 compared to a budget of $6,632. Total revenue is $6,676,000 compared to a budget that is roughly $90,000 higher than that. So overall in residential living revenue due to occupancy below budget, we are about $90,000 behind budget in revenue. Any questions on this slide before I move on? Is anyone wondering why monthly revenue per occupied apartment is not what we budgeted? It seems pretty straightforward, right? We know how much people are going to pay.
And what we pay,
Yes.
we don't pay $6,667.
You may not, but somebody else might. So it's an average of all of the apartments that are occupied. So in that, yes, in residential living. So in that you have patio homes, you have 1 bedrooms, you have 2 bedrooms, you have alcoves. And so it fluctuates a little bit based on, what apartments are occupied and what apartments are unoccupied and under renovation. And so it's pretty close to the budget, but slightly off because of those fluctuations. Yes, Frank.
You have what percentage of the total amount each one of these is, just one shot?
No, that's a good question though. I don't. But I can get it. Kendall is taking notes, so we'll get a sort of a breakdown of the different apartment types and the. Okay, yeah, we can get that. Good question. Any other questions before we move on? All right, moving on to, oh, yes.
So how much is this negative in budget is caused by that it seems to take in average 4 to 5 months to repair an apartment?
So yes, all of the variance is due, not all, nearly all of it is due to just apartment remodels. And the more apartments we have to remodel, then the lower the occupancy is. Apartment remodels are taking about 120 days on average.
Why?
For a number of reasons. I mean, the short answer is because that's how long it takes the contractors to do it. Slightly longer answer without spending too much time on it is we've had a significantly higher number of apartments turned over due to residents transitioning or residents passing away. We primarily work with one contractor, and we've done that by design over the years because we want to work with a contractor that works well with us and provides a high quality product. We've looked at and tested out some other contractors over the past few years, and we've always kind of gone back to sticking with one, which causes a little bit of delays when they get stacked up and more work. But we're exploring the possibility of additional contractor now that would hopefully speed that process up a little bit. Okay, any other question before we move on? All right, next, the Lodge Assisted Living. So we see here, we have 45 apartments in assisted living. Average occupancy year to date is 41.7, 92.6%. Monthly revenue per occupied apartment, $7,731, which is $205 lower than budgeted. So total revenue in assisted living is $1,932,000 compared to a budget of just over $2 million. So $139,000 behind budget in revenue in assisted living. Just below where it shows total revenue, we see benevolence write-offs. And essentially what that means is this number right here is the number, the dollar amount that the foundation has covered for residents living in assisted living year to date. So all of the contributions that you make to the Benevolence Foundation, a portion of that, the $85,000 of that so far this year has gone to support residents living in assisted living. Just below that, we have AL assisted living FTEs, which I probably should have written out, but that's full-time equivalents, basically number of full-time team members in assisted living. We are at year to date an average of 23.3. Total employee cost, $667,000. Non-wage expenses, $31,000. Overall operating expenses in assisted living, just shy of $700,000 compared to a budget of $730,000. So we have $32,000 positive variance year to date in operating expenses in assisted living. Down the bottom line is assisted living direct margin. So what this number is all of the revenue less all of the expense. So the direct margin for assisted living, 1.2 million compared to a budget of 1.3 million. So about $100,000 behind margin target in the Lodge. Doris, question?
Yes. Could you tell us whether the amount that we received or augmented your budget from Benevolence is to be expected for the next 6 months? In other words, you think there'll be approximately another 84,000 needed?
That's a very good question.
You just use it from your experience.
The number, the amount of monthly benevolence support needed over the last month or two has declined from the first 4 months. And so as it sits right now, we anticipate it to be a little bit lower for the next 6 months unless a need arises that we're not currently aware of. Any other questions before we move on to the next slide? Okay. Next slide is the Grove memory support. So this looks very similar to the last slide where we have occupancy. In the Grove, we have 16 available apartments. Year to date, we average 15.3 occupied apartments with an average monthly revenue per occupied apartment of $12,062. Total revenue, 1.1 million in the Grove. No benevolence support needed so far this year in the Grove. Moving down below, we have memory support full-time equivalents or team members, 15.9 team members that directly work in the Grove with a cost of $470,000. Non-wage expenses, about 40,000. Total operating expenses in the Grove are $509,000 compared to a budget of $442,000, so $67,000 over budget, primarily, as you can see, due to the employee costs, which are $63,000 higher than budgeted. Overall, operating direct margin in the Grove, $597,000 compared to a budget of $619,000. So there is a deficit to the budget of $22,000 in memory support. Yes, Susan.
Is that figure due to the fact that you're understaffed and have to cover with overtime and temporary people, or is there another reason?
I am so glad that you asked that question, because the Grove is, they are a wonderful, wonderful team. In the Grove, as well as assisted living, the caregivers that work in those areas are not required by us or by regulation to be certified nursing assistants. Typically we have a combination of resident assistants that are non-certified and certified nursing assistants. Certified nursing assistants get paid a little bit more. At the beginning of this year, and I think a few at the end of last year, every single, except maybe one, every single resident assistant that works in memory support went to school after hours, supported almost entirely, or maybe entirely, by the Robert Foster Family Education Fund and the Human Good Education Fund, and they became certified nursing assistants. What that does is that increased their skill set, their training, and it also allowed them to all get pay raises. And so the wages per hour are higher than what they were at the beginning of the year because of that education they got. Judy.
Where do you show the expenses for the dining room and maintenance and concierge and all of that?
That's a great question, and we'll get there. If you don't mind waiting a few slides. Angela.
Okay, total available apartments.
Total available apartments are 16, and the full-time employees are 15. Does that mean there's 8 during the day and 8 at night, or is that one per?
The staffing levels fluctuate based on the shifts, and I don't know the individual breakdown, but loosely speaking, on the day shift during the daytime, there's probably 7 or 8, depending on the day. The PM shift, there's probably 5, and then the rest on the night shift. So,
Because I was looking at the lodge also, and there's 45 apartments, and it's showing 23 full-time employees.
yes. So the ratio of staff to residents in the Grove is higher than the ratio of staff to residents in the lodge due to the higher needs of those residents in memory support. And that's why the monthly fees are significantly higher in the Grove than they are in assisted living. All good questions. And actually, Judy, coming back to your question, I should clarify that all of the non-wage expenses and employee costs are just those incurred directly by those team members within those departments. So food costs aren't factored in here. It's a separate budget that we'll get to. All of the ancillary supportive staffing from housekeeping, maintenance, all of that is in a separate, is not included in here. But we'll see where it's included shortly. All right. Next, health center. Buckle up, because this is where it gets super complicated. And I'll try to make it as least complicated as possible. In the health center, we look at, we don't look at our revenue on a monthly basis per se. We do, but we really break it down on a daily basis. And we break it down by the different payer sources in the health center. In assisted living and residential living in the Grove, primarily everyone's monthly fees are paid by private payment. There's some insurance that is factored in, but it's primarily all private pay. In the health center, we have a significant amount of the revenue is paid through insurance, through private insurance, through Medicare, and also through private pay. So this first slide here shows the breakdown in occupancy in the health center on a daily basis by payer type. So we have, I'll start at the bottom actually. Our average occupancy in the health center year to date is 86%. Of the 59 total rooms or 59 total beds in the health center, we average 50.8 beds filled. This is the breakdown of by payer type. So there's 8.8 on average residents that are contracted TLG residents that pay privately for their room and board. 3.8 non-contracted residents, so not contracted residents of the Terraces de los Gatos that are paying privately. Medicaid or Medi-Cal, we have 4. Medicare, Part A, but it's Medicare, 30.8. Managed care, 3.4. Generally speaking, these last 2 payer sources, Medicare and managed care, are short-term stays in the health center after somebody has had some kind of a change of condition or an injury or surgery. And then these 3 are primarily what we would call long-term care. They live and in the health center, and the health center is home for the foreseeable future. One thing to point out is you can see here our Medicare actual average daily occupancy is 7.8 points above the budget of 23. And that is very significant, and I will show you why on the next slide. This next slide shows the average daily rate based on payer sources. So a contracted TLG resident pays on average $491 per day. Non-contracted resident, $687 per day. Medicaid reimburses us roughly $406 per day. Medicare reimburses us just over, on average year to date, just over $1,000 per day. In the health center, managed care is other insurance types that are not Medicare. So Kaiser is your United Healthcare's and $762 per day. So the average total average daily rate in the health center is $843, which one is over budget by $114 per day, which is great. And when we factor that all together with the average occupancy and the average daily rate, year-to-date revenue in the health center, $7.75 million compared to a budget of $6.5 million. So roughly $1.3 million in revenue, higher than budgeted in the health center. So that's why that Medicare number is so significant. We've had $5,200 year to date in benevolent support provided for residents in the health center. Questions before we move on? I only see a few people sleeping so far, so that's good. Gunilla?
Michael, okay, thank you. So if we look upon how much how much is the operating margin for the health center?
Yes. We'll get there.
Okay.
The next slide, we're going to start looking at the expenses in the health
Sorry.
center. Okay, so now we're going to get into expenses in the health center. So in the health center, our health center full-time equivalents or employees are actual 62.8 compared to a budget of 56.8. So we've had on average 6 employees more working in the health center than budgeted. This number is super complicated. Well, it's not actually super complicated, but it's a formula that's used to calculate how many nursing hours per resident per day we have providing care and services to the residents. So on average, 4.8 hours per patient day compared to a budget of 4.5. This, we look at this one for sort of an operational metric, but also because there's a regulatory requirement of having certain levels of staffing in skilled nursing facilities. The current state requirement is 3.5. So we are well above that state required minimum. When we look at employee costs and other expenses, we see, fortunately, we have a lot of above budget revenue coming into the health center, but we also have expenses that come along with that additional revenue. So total employee costs year to date, $544,000 higher than budget. Ancillary services, $158,000 higher than budget. Other non-wage expenses, $79,000 higher than budget. So year to date, we have spent $781,000 more to operate the health center than we budgeted, which seems crazy. But if we look back to that last slide, we have that additional revenue that more than offsets the additional expense incurred in the health center. So that results in overall direct margin in the health center of $3.375 million, which is $511,000 higher than budgeted year to date. So we love the health center because it plays a significant financial role in the overall operation of the community.
Where do physical therapists run in this?
Good question. Where do physical therapists run in this? So when somebody stays in the health center and they're covered by insurance, they're covered by Medicare, and most insurances, all the insurances work a little bit differently. But generally speaking, how it works is they pay us, whether it's Medicare or another insurance provider, a set amount per day. Medicare on average is $1,000 per day. But what that does is then nothing else is billable out to insurance. So they pay the community $1,000 a day, and then we incur all of the expenses that are needed to provide the appropriate level of care for the patients or residents in the health center. And so we have a line item here, the ancillary services expense of 1.1 million year to date. That expense right there is all of the services that we provide that are covered under that sort of Medicare or other insurance benefits. So that includes physical therapy, occupational therapy. It includes medications, lab work, radiology when that's needed. So that all falls under this category here. Any other questions before we move on? All right, we'll keep going. Wellness. Wellness is an interesting department because there's a little bit of revenue in the wellness department, but primarily wellness is an expense department. Total revenue January to June from the wellness department is $47,000. That is primarily for residents who are receiving medication management services in residential living, residents that are in assisted living. There's a assisted living and memory support. There's a fee for pharmacy fee if you're using an outside pharmacy. Non-emergency nursing visits fall under that revenue. So $47,000 in revenue in wellness, 15.8 employees compared to a budget of 14.1. We've staffed a little higher than budgeted. Total employee costs are $144,000 higher than budget. Non-wage expenses are a little below budget. Overall operating expenses are $137,000 over budget, which gives us a net direct margin in wellness of negative $640,000 year to date. So that number right there is actually that number is what it takes to operate the wellness department. When you factor in the revenue, that's our margin for the wellness department. Other revenue. So there's two line items here. Foundation distributions. It's in short, the simplest way to do it, to explain it is $89,802 is what has been covered by the benevolence, by the foundation through for benevolent support year to date. And other operating revenue, $136,000. That is revenue, miscellaneous revenue that comes into the community when there are trips and outings, things that are added to your monthly bill that are not part of the routine services available. The reason that this is significantly higher than budget is most of you are aware, right around the start of the year, we changed the way we operate the salon. And so we used to not see any revenue and not see any expense related to the operations of the salon, because essentially it was contracted out. There was a shift that we made, and so now the team members that work in the salon are employees, and so the revenue and the expense we incur both the resident we receive the revenue and incur the expense. So that's what drives that over budget. This is an exciting slide, right? We will not go through every single line item, but this is a breakdown of our year-to-date non-wage expenses. I will leave that up there for just a moment and have you take a look at it. Look on the printed slides if you would like. And then I'll answer any questions. And then there's one or two things I may mention. Overall, we have spent roughly $6 million year to date on non-wage expenses compared to a budget of $5.8 million. So we've overspent in non-wage expenses by $143,000. We can see here some key things that I'll point out. Direct resident care. That's the big one. Some of you may be wondering, wow, that's a big number. Why are we spending so much on this line item that says direct resident care? that line item is primarily the ancillary expenses in the health center that we were just talking about, for therapy and for pharmacy and other expenses incurred providing care for those residents in the health center that are there under a Medicare or insurance covered benefit. Because the occupancy in those payer sources is significantly higher than budgeted, the associated costs to provide the care for those residents increases incrementally as that occupancy increases. So it is above budget, but in a way, it's a good thing because that's an indicator that the occupancy in the health center is higher than budgeted. Utilities. Right here, we see $534,000 year to date, $20,000 over budget year to date. We just got July's numbers out. You can add another $80,000 on top of that. So for utilities. Well, I'm incorrect what I said. Our utilities bill for July was $80,000, which was roughly $20,000 over budget. So this number here, this negative variance of $20,000 will doubled in the month of July. Utilities are going up. Thank goodness we're getting that solar. Sharon.
I was just going to say, will the solar help that?
Yes.
And would it also help if people were reminded to turn off their lights when they're not in the apartment or in certain rooms?
It would certainly make an impact. Yes. So I'll use this opportunity to plug next Tuesday, August 22nd, 2 p.m. here in the GRA for a presentation all about the solar program that's we're bringing to the community. Judy, you have a question?
Why isn't dining the actual expenses versus the budget lower since we're short staffed?
So this dining is, this line item is not staffing. This is a combination of supplies, equipment, and food costs. So you can see we have a positive variance, which means we've spent a little less than budgeted on those non-wage dining expenses.
It's non-wage, sorry.
Yeah, non-wage. One of the significant reasons for that, fortunately, is that we have had a significant decline in the amount of to-go supplies that we've utilized this year compared to last year. So we sort of based our numbers based on prior years, and so that's one of the factors. Any other questions on these non-wage expenses before we?
What kind of non-wage expenses, could you help us understand that a little better? Since Morrison does the cooking area and we do have wages for the wait staff, thank you.
So, yeah, so this, what falls under here in the dining non-wage expenses, this total of $900,000 a year to date, is all of the food, all of the raw food, all of the to-go container, everything that we use in the dining services department that is not a person. No, we pay for all of those supplies. It's the sort of inventory management and ordering is handled by the Morrison team. But we just pay the bill, so there's no markup on it. It's not that Morrison pays the bill and then they charge us a different amount. We just pay the direct costs of those supplies. Yes.
You also have things like china replacement, glasses
Mm.
replacement, linen services, uniforms for the staff. I don't know if that's included also.
Yes. Thank you. I didn't think of all those things. There's a lot that goes into it, but. All right.
What's bad debt?
What's bad debt? Bad debt is bad.
I heard that.
So bad debt is the amount of revenue that we bill for, that we book the revenue, but we are unable to collect it for one reason or another. Almost entirely, it's insurance related. So we bill out $1 million to insurance, and we anticipate there is a percentage of that for one reason or another, we won't be able to collect. And that amount that we aren't able to collect is a bad debt expense.
Bradley,
Yes.
I have one question about an expense I think that I don't see accounted for anywhere. This 20-some number of residents here are living in independent living in below market rate apartments mandated by the town, I guess.
Yes.
So that represents a loss in revenue. And where is that accounted for?
Good question. So we don't book that as an expense per se. It is just factored into the average monthly rate for primarily residential living, but not necessarily exclusively residential living. Good question. Thank you for asking. All right. We will, yes, Terry. Oh, let's wait a second. Judy's on the way. Thank you, Judy.
Okay. All the way. Okay. A friend of mine who was moving down from another state called Human Good and said to them, is there any chance that I might be able to get a lower payment because she is on Medicare and needs help? And they said, oh no, that's all been distributed to somebody else. You don't do it anymore.
The question was about, if I understand correctly, a prospective resident that was inquiring about any subsidies or support based on resources or insurance.
When we agreed to do this situation,
Uh-huh. Oh, okay. So the question was, and I'm going to dissect the question a little bit, but the question ultimately is, are there currently spaces available on the below market program at this site? I don't actually know at the moment. Sandy Mirasol manages all of that. I don't know how many we have currently. I don't know who's on the below market program, but Sandy would be the best person to connect with about that. Okay, I'm going to speed up really quickly because time is going quickly. This is a breakdown of employees, budget actual compared to budget. As we can see, it may be a surprise, but we are staffed at 228 full-time equivalents or team members compared to a budget of 217. So we have 11 we're staffed year to date, 11 team members higher than budgeted. Most significantly, that's in direct resident care, which is the health center due to the higher occupancy in the health center. Employee costs, this sort of breaks it all down. between regular salaries, overtime and double time, outside labor, incentives, bonuses and awards, non-productive salaries, which is vacation time, primarily. Total salary and wages, roughly 8 million compared to a budget roughly of 7 million. So we are about close to $1 million or $900,000 over budget in our total employee costs year to date. Phil.
Question.
Yes.
In previous years, you pointed out that you were going to work on the overtime aspect of the labor and the overrun. Have you seen any reduction in that this last year or this year?
A good question. Yes, we have seen a reduction. I don't know if it's on one of the slides that we'll get to. I don't recall, but we'll find out. But the short answer is yes, we've seen a gradual decline, not as quickly as we would hope, but we've seen a decline. All right. The next several slides are graphs. And I'm actually going to skip through some of them and get just to the ones that I think are most impactful and you may be most interested in due to the sake for the sake of time. So this one shows the next several slides. We compare current year to date, which is the gray line, compared to 2022, which is the orange line, and compared to 2021, which is the blue line. So this first one is revenue. As one would expect, revenue increases incrementally each year due to resident rate increases and insurance billing in the health center. Total employee costs. This one is interesting. Year to date, you can see we actually have a slight decline year to date in total employee costs. And that decline is due primarily to that incremental reduction in outside labor, which is very expensive, and overtime, which is also very expensive, but slightly less expensive than outside labor. Non-wage expenses, you know, that's helpful to see, right? Bunch of jumbled up numbers. We'll skip over that one. Operating margin. Somebody on our budget planning committee said when they saw this slide, I'm glad you're the one that gets to explain this one and not me, because it makes no sense, which is totally valid. I kept it in though, because I wanted to show that the operating margin is, we run a business, we run a community, we run an operation that it fluctuates tremendously every month, sometimes by the day, based on any number of factors. Mostly in the health center, there's a lot more of this in the health center on a daily basis than any other areas of the community. As you can see in this year, the gray line, we're sort of kind of right in line with where we've been in previous years. We hope to not see this same significant reduction, which we're not trending that way this year, although there was a little bit of a dip in June. July, there was a slight increase. So that is the operating margin this year and the previous 2 years. Full-time equivalents, that just shows the trend of staffing levels on a monthly basis over the last 3 years. Overtime wages. Okay, so we do have a slide that shows this. Overtime, if we look at where we started at the beginning of the year, we dropped significantly in February. We've sort of tapered up a little bit and we're trending back down. As a percentage of total wages, the improvement is a little bit more apparent if we looked at it that way. Outside labor, you can see here where we picked up at the end of last year. So this is the end of last year, brought us to the start of this year, and we've seen a steady decline month over month, a little bit of a jump in June. We had a little bit of a jump in July as well, which we don't see here. But we anticipate / hope that we continue to see a steady decline throughout the rest of the year. Yes.
That last one that you were at just now,
Yep.
is that going to increase significantly as the solar panels get put up and so on?
Oh, good question. No, this outside labor is only, it's team members that are providing direct services to residents. So contractors, contracted labor, that is, that's confusing. Contracted labor related to physical plant projects and things like that, that's separate. This is nurses that we bring in from an agency to cover temporarily kitchen dining services team members, sort of temp labor. Phil.
You may want to save this question till next week, but are all the savings coming from the solar panels going to go into your budget?
Good question. I'm sure we'll talk about that more next week, but my understanding is that the expense incurred for the installation of the solar system is being covered through capital expense funds, but the savings will come to the community's operating budgets. So we don't pay for it and we get the savings. So yeah, that's good. Okay. Oh man. Okay. I'm going to skip ahead to a couple of things because there's a few slides I definitely want to get to. Total annual employee cost. So this is everything that we pay for wages, salaries, wages, benefits for team members. And this shows the last 4 years and our current projection for this year. So in 2019, we spent roughly $14.3 million for the year on our team member employee costs. Went up in 2020, went up a little higher in 2021, went up significantly higher in 2022, and continues to rise this year. Next is employee cost per FTE. So basically this is each individual employee. This is the average expense for each individual employee. In 2019, roughly $66,000 per team member, and we have increased to over $85,000 per team member this year. It's a big jump. In fact, it's a nearly 30% jump over the course of the last 4 years. Gunilla.
A quick question.
Yes.
On that. How much is that reflection that you have much higher qualified nursing personnel now, and also has added on some more high-level people to take care of entertainment for the various areas and so on?
That's a good question. And I don't have it broken down sort of anecdotally. I would say the vast majority of the increase isn't necessarily due to increased skill sets or qualifications. It is just due almost entirely to market demands for wages. So there is a little bit of factor of like the resident assistants that became CNAs, LVNs that may have become registered nurses and their rates go up. But it's really just due primarily to rate increases for existing team members and the hourly rates or salaries at which we're hiring new team members compared to where we have been in prior years.
Does that also include insurance costs?
It does include insurance costs. So this is overall costs, including insurance, including benefits. So I'm glad that you mentioned that because there is increases annually on insurance and other expenses related to team members. But this is quite striking when we look at it this way. And I think this really makes it real when we talk about, labor and the need to balance the costs of labor, which ultimately are paid by the residents, with making sure that we meet the needs of the residents. So, yeah, we are, I'll show you one other quick slide here. Employee cost as a percentage of revenue. And so what this slide shows is what, we have our total annual revenue, what percentage of that revenue goes to employee costs. 4 years ago, it was 39% of the revenue went to employee costs. We are on track so far this year to be just at 45% of revenue going to employee costs. Phil.
Just quickly, this is just for our own labor, but everything we buy here, including food, transportation, medical supplies, also has a content of 45% of labor, which is probably results in about 75% of our costs being driven by labor, either internal or external. So we kind of live in a cocoon here, but when you see evidence of rising cost outside, this is what it's doing to our rents. So.
We have a question.
Yes.
Bradley,
Yep.
what percentage do you think might be offset by the savings we'll have with solar?
That's a good question. It wouldn't impact this because we're just looking at employee costs. I don't know off the top of my head. I know we have a projection of the dollar savings for the solar system. I don't know what it is though. Next Tuesday at 2:00, we'll have that number to share. Frank.
If I understood correctly, with respect to solar, the expenditures are going to be expensed and then not capitalized. So it seems to me that's going to cause a big increase that's not really due to an efficiency measure, but due to the mix between capital and labor. So it seems to me sooner rather than later, you're going to want to separate things like
Can you repeat the question, Bradley?
The question is, what we're expensing, it seems, the cost of the solar, not capitalized it. Is that right?
So thank you. For clarification, the expense associated with the solar installation is covered through the human good capital budget. So that's all capitalized. So we won't incur any of the expenses at the community level, but we will reap the rewards of the utility savings.
Okay, thank you.
You're welcome. So to wrap up, the Terrace de Los Gatos is in a financially stable position. Operating expenses, primarily wages, rise and continue to rise, but increased revenue due primarily to annual monthly fee increases and health center occupancy offset the rising expenses. Are there any other key points that anyone would like to share or make or questions? I know we are over time, but I'm here if anyone has any additional questions or comments.
Somebody asked me earlier today, is there going to be any impact of what we learned today? And let me venture what my impact was. If we were having declining operating revenues, or if we had increasing cost or decreasing revenues, that would be hazardous for the.
Yes.
business. And I said, how would I translate that? I would say, well, maybe our fees, maybe our expenses are gonna go up. We'll get an envelope that says it's gonna cost more. Now translate that in today, I see no reason for us to be concerned based on the data we have about the cost of of what we're gonna have to pay. Is that a good translation of?
I think that's a fairly accurate summation. Costs continue to rise, but our revenue has incrementally risen to offset those costs. What we anticipate between now and the end of the year and going into next year, a little bit of a to be determined of how that may impact annual fee increases. Judy?
So my question is similar to this one that we just had, which is what are we to learn from this that applies to what we can expect for any increases in our monthly fees in residential living, especially since services and dining and so on have dropped?
So I don't want to, I mean, I can't make any announcements about what increases will be because one, we haven't gotten there yet. But what I can do is, so if we look at this slide from 2021 to 2022, we had a 13% increase that year in employee costs. Last year to this year, we have an increase anticipated of not quite that high. So some may deduct that the fee increase next year at the end of this year would probably not be as high as it was last year. But we will see between now and the end of the year.
Last year, there was on one slide an item of our obligations to pay to the headquarters was per month. And
Yes.
I didn't see that anywhere this year.
That is, where are we? Here, that's under non-wage expenses, group management fees, 1.3 million. So that is all of the accounting, legal, clinical consultants, all of the corporate support that we pay for. So that's what goes to cover all of the human good expenses. We have one more question? Yes. Linda. And this will be our last question, then we'll wrap.
Okay. How would the points we get allocated every month for dining or eating food, would that be reflected in the inflation and or the adjusted according to the increase in monthly fees we pay? So they will not suddenly wake up and say, oh, we need to adjust it. Each meal is, each food is increased by 20 or 30% one day. I would rather be a gradual build up rather than suddenly we find out it's in the red.
A good question. So
Can you restate this?
so the question is, if the, and I'll rephrase it slightly, and if I change the intent of the question, let me know. As there are increases in costs of food, let's say, do we anticipate if the cost of food goes up, we increase the points that we charge for the food? And the short answer is no, not really, because really the points are not necessarily tied to dollars per se. It's really just a way that we can sort of manage and equally distribute the food consumption across all their residents. The only way that we actually see an impact on the financials for dining points is if somebody goes over and they spend more. And so I think a few years ago, before I started, I think there was a change to the points allocation. I think the costs went up a little bit. And then the distribution of points also went up a little bit, with the idea of making sure that when there are people that pay extra for meals over their points, that they're paying roughly the equivalent. But essentially, no, you shouldn't see fluctuation in points based on costs of food, generally speaking. We went 10 minutes over time. Thank you for your patience. Thank you for being here. Have a wonderful afternoon. The slides will be available on TLG Connect too, if you want to take a look at them. They'll be up this afternoon. Thanks, everybody. Have a great afternoon.